So now we're going to reintroduce the stabilizer. We did it for the cervical spine. We're going to now do it for the lumbar spine. A little bit of a different sequence for the lumbar spine. So the first thing you're going to do, I'm lying flat on it. It is not folded. It's just lengthwise under the small of my back. And I've got this. I'm going to let out a little bit of air because I want the needle to be roughly at 20. So now what I'm going to do is I'm just going to start out by pushing down flat into a little bit of a posterior tilt until I hit 40. I'm right in that orange line there. I don't know if you can see, but I'm pushed to 40. So now at this point, we can just work on holding contractions. Sometimes I'll have patients work with this one up to 30 seconds because I want them to sort of build up some endurance here. Now, the point of this is just understand that you want to stay in that 40 range. You don't want them to go above 40 too much because now that means I'm in a posterior tilt. So now I've pushed it up to about 70 or so. So you want to use this as a tool to help your patient understand where neutral spine is. It's a little bit of a different goal in the cervical spine where we're working a little bit on proprioception, the ability to fire the deep neck flexors, of course. In this case, it's partly an ability to use the abdominals, but it's really a proprioceptive tool to say, do you know where neutral spine is? And we can make a pretty good estimate that going from 20 at rest to 40 with a tilt, the patient's got some space there, right? So again, if they're pushing too hard, there's a window here above and below 40. Maybe I usually use a couple of millimeters of mercury leeway. You don't want it to go outside of that. If the needle goes down too much, it means they're starting to drift into lordosis. And again, if it goes way above that, they're in a posterior tilt, they're actually going into lumbar flexion. So you want them to live at 40. So once they work building the way up to maybe being able to do a 30-second hold, we're now going to introduce this idea, getting the upper extremity and or lower extremity to move while they're maintaining this 40 position. So I may start out with, let's say I can hold it for them, okay? So they're going to be looking at this and it's at 40. I can do upper extremity motion. I can go like this. Remember, the farther away from midline it goes, it's harder. So if I take a look at this now, if I don't really think too hard about it, my rib cage wants to come up. So now I may want to work a tiny bit harder just to keep that thing at 40. And now I've got to fine tune. When the arm comes down, if I'm using the same amount of pressure, now the needle moves up a little bit. So the idea is that there's some fine tuning of the positioning of the pelvis and the lower lumbar spine while the arm is moving up and down. Next step is to try lower extremity. So this is sort of working up towards the dead bug variations. Now for me, you guys can't see it, but I'll try to show it to you. Watch what happens. So when I lift up my left leg, I've got pretty good control here. That thing's pretty glued to 40. Now my right leg, this needle starts to bounce all over the place. So I've got some little bit of an asymmetry here. So if you have one of these stabilizers, again, you don't have to go buy one. If you happen to have one, if you have a blood pressure cuff, see what this looks like for yourself. If not, if you don't have a stabilizer, just sort of get used to the idea of flattening your back. Let's say we get rid of this thing. Just put a hand's width there, and that'll give you a sense of, okay, if I can fit my hand there, I've got some curve, but not too much, and that's roughly neutral. And then you could practice the same idea of doing upper extremity and lower extremity movements and get the sense of, does your spine twist a little bit? Do you have too much lordosis? Do you round too much? These are the things you want to work on with your patients in this very fundamental way. And now we're building our way up into doing some dead bugs, which we'll do in the next video. I want to just go back to the transversus abdominis. Do this same basic routine, practice this, basic upper extremity and lower extremity motion, firing the transversus abdominis. Different goal than maintaining neutral spine. With the transversus abdominis, you're not really changing spine position. You're leaving that all alone. You're just trying to fire that muscle and then practice these same basic leg movements. Then alternatively, practice what we just discussed, which is keeping a neutral spine, a little bit of a space there. Now you're probably bringing in some more superficial muscles, and then go through the same basic upper extremity, unilateral or bilateral flexion, and or you can add in lower extremity. You can put in the lower extremity with the hands on the ground. And then next, we'll do some dead bug variations.